let's move on and let's put the spotlight on Narayana Health as well, because the company has come out with a very interesting development wherein in order to expand their offerings in the cancer-related and oncology segment, the company has formed a joint venture. So let's understand what does it mean for the company and what's the way forward. We are being joined by Viren Prasad Shetty, Executive Vice Chairman of Narayana Health. Hi Viren, good morning. Good to be speaking with you. Firstly, tell us about this new JV. What kind of an opportunity do you see in the oncology space, and how much revenue will it generate for the company? What's the expectation overall?
Sure. So the venture is a joint venture between us and a newly formed company called 2070 Health. 2070 is an incubator that operates a bunch of almost startups in the healthcare domain. Our venture will be called Everhope Oncology, and we are investing about 50% of equity in this company. And the idea is for us to create infusion centers, surgical oncology centers outside of hospitals. We're seeing a growing trend of patients not wanting to get treated inside the hospital, and they would like to get operated much closer to home. And so this is a way for us to invest in a company that's doing more in that space.
Right. Viren, hi, morning. You said that over the next 1 to 2 years, the total investment is going to be about $10 million. Tell me how much Narayana is investing from its books.
A little over half of that.
Okay. And you also said that, recently you're going to be raising or rather laying the foundation of 1,100-bed super specialty hospital in Kolkata as well. You said that you're going to be making a 900 crore rupee investment in the first phase. Tell me, what's the time frame and, what's the execution like so far?
So just to clarify, these are two very different things. The investments we're making in hospitals and capex insurance, that is 100% investment run by our company, and that is part of this multi-year capex roadmap we have for expanding our presence in Bangalore and Calcutta with integrated care models, which is hospitals, clinics, pharmacies, diagnostic centers, and insurance. This is all operated under NH, and it will all be managed by us. The hospital in Calcutta is one phase of it, and we're opening up a couple more in Bangalore as well. The joint venture we're doing at 2070 Health is an investment in a separately managed, separately run subsidiary that will be doing a lot more low acuity care, but specifically focused on oncology with a separate team, separate management, separate joint ventures with doctors. Our involvement in that venture is just on as an investor, number one, and number two, providing a lot of back-end support. We'll be supporting them with supply chain, software, clinical standards, governance, and so on, but we will not be actively pushing that as an NH-owned company. This is something, it's a new model that we're just trying out to see if we can make something a lot smaller, scale in a very asset-light way. Whereas what we're doing on the NH balance sheet is the capex-heavy, asset-heavy investments.
All right, but Viren, also give us some sense that over the next 2 to 3 years, what sort of a capex plan does the company have, and how much bed addition will the company be doing? And along with that, how do you plan to fund all these capex? Because given the fact that for the next 2 to 3 years, help us understand what's the visibility, and including the Kolkata expansion, what are the plans to fund the same?
In 3 years, so far, what we've announced would amount to about 2,500 crores in capex, but it would be significantly more than that. Over the next 5 to 10 years, we are deploying a significant amount of capex towards expanding our presence in Bangalore, Calcutta, Raipur, as well as opening up smaller expansions in the existing assets we have across the country. Funding of this will be a combination of debt, internal accruals. Debt will be commercial borrowing from NABFID, which is the infrastructure financing arm, as well as from NCDs.
All right, but Viren, what we understand is that the company has already projected capex of around 1,635 crores for FY25. Until Q3, only close to 700 crores was done. Will you be able to reach to those projected levels of capex, or will there be any shortfall, and then maybe ahead in FY26 we can see some bit of a pushover in terms of your capex related announcements and expenditure?
Yes, that would happen. The intent to spend is there. It's just that it takes a lot of time, effort to push through a lot of the regulatory issues, the forms, licenses, permissions, finalizing contractors, finalizing designs. These are the execution challenges that we as a company face building these hospitals, but they will be spent. It may just get pushed out a couple of quarters in the future.
Viren, lastly, I want to talk about insurance because after Aditi, you've now launched Arya Insurance Plans and also Health Insurance Commission. Cayman Islands has issued an insurance certificate as well to you. Tell me what exactly is happening on insurance and where do you see this business scale up, say, in the next 5 years?
Sure. So we find that a lot of patients really struggle to pay for healthcare out of pocket. And we find that no matter how efficient we get, there's still the question of people being able, even if you take a 5 lakh rupee procedure and make it 2 lakh rupees, it's still 2 lakh rupees that a lot of Indians don't have. And insurance is the only solution. But what we've seen is that nearly every health insurance product in the market looks the same. It is the same price, it is the same offering, and it is completely undifferentiated. We wanted to come up with something a little different, a hospital-owned insurance plan that covers you comprehensively, but in a narrow network. And so the scale would not be similar to what you'd see with the existing players in the market. We're not looking to be a national player. We're not looking to sell millions and millions of policies. What we want is in every city where we operate, we sell a significant number of policies to a certain niche segment of the population who are happy being restricted to a narrow network for primary care as well as surgeries. And so the numbers that we're projecting would be modest. It would scale up, but it is more in line with our philosophy of being able to provide integrated all-in-one care.
Okay, great. Viren, good to have you on the show and good to be speaking with you as always. Okay, that's the word coming in from Narayana Healthcare. If
you like this video, then like, share and subscribe to ET Now.